Today we are streaming live from Evoluon in Eindhoven. The city of Eindhoven has been the home of Philips for 125 years. Evoluon is a former science museum that was built by Philips in 1966 and is now a landmark and a symbol of innovation. Hello and welcome everybody, and thank you for joining us today for Philips The Next MR Wave live stream. It's exciting to see that we have over 800 people joining from around the world. Today, Arjen Rade, the CEO of Philips MR Business, will join me to host today's live stream session to learn how MR Solutions are helping to solve radiologists' biggest challenges. We will hear from well-known hospitals around the globe about the challenges their radiology departments are facing. A group of radiology experts from different fields will discuss their day-to-day pain points and how they utilize Philips' latest innovation to address these issues in their facilities, sharing some of their early successes, best practices, and their vision into the future of radiology. So let's welcome our experts. We have Dr. Martin Le Quin, who specializes in pediatric neuro and oncoradiology from the University Medical Center Utrecht in the Netherlands. He has a strong record in research publications and is one of the most experienced neuroradiologists in the Netherlands with more than 20 years' experience. Next to him, Dr. Mark Oswood specializes in neuroradiology from Hennepin County Medical Center in the United States. He has 15 years of neuroradiology experience and is passionate about educating the up-and-coming radiologists. Next to him, Dr. Harsh Mahajan, radiologist, founder and CEO of Mahajan Imaging Center in India. He has more than 30 years of radiology experience. In Dr. Mahajan's leadership, Mahajan Imaging not only provides high-end imaging services, but also leads many research collaborations with international institutes like MIT and Max Planck. Then we have Dr. Christoph Jüli. He's an established cardiac radiologist with more than 20 years' experience. He's led the cardiac imaging service of the radiology department at Imperial College London for several years and is now working for Uster Hospital in Switzerland. And last but not least, we have Dr. Rikmer Brachen. He specializes in GI radiology and oncoradiology, has more than 10 years' experience from the Technical University of Munich in Germany and a strong track record in research publications. Well, thank you all for joining us. Let's now share with our online audience what we're going to discuss today. First, Arjen will talk about how to break diagnostic boundaries and touch more lives with Philips. There are three main challenges in radiology departments, and we'll hear about those in detail. How does your facility improve productivity in your MR imaging service? Do you perhaps increase the speed of scanning or patient preparation or something else? How do you improve patient experience and patient comfort with MR? And also, how do you improve the diagnostic confidence without compromising on speed and patient comfort with MR? Afterwards, we'll end the session with a quick recap by Arjen. And for online viewers, there are two ways to engage with us today during the panel discussion. One way is to answer the poll questions shown on the right side of your streaming screen. Another way is to ask questions directly through the comment box, which is also located on the right side of the screen. All the questions submitted during the event will be shown with the nickname that you have entered. So now we've covered that, let's welcome to the stage Arjen Rade, CEO of Philips MR. Welcome. Hi, this is going to be some fun. I hope it goes really well.
Thank you very much, Sue, and hello everyone, wherever you are in the world. We are very excited to have so many participants join us for the discussion today. Now, I know that the most important part is the panel and the panel experts, and I'm personally looking forward to these expert opinions. But still, I want to take a few moments for a short introduction. Now, when I wake up every morning, I feel blessed that I can look at this guiding statement that we have in Philips. Our ambition is to touch the lives of 3 billion people by 2025. And that's a big challenge. It's a daunting challenge, especially if you know that we're at 2.2 billion today. Work to do, but I have to say in Philips, and I personally like that kind of challenge. So what can MR do to contribute to making a meaningful impact on the life of so many people? Now, one thing that's very important for me is understanding customer needs, understanding your needs. And of course, one way to look at it, and I know I'm preaching to the converted, is looking at the quadruple aim. When you look at cost, and I realize that 7 trillion that we spend in 2015 is a lot of money, but think about what we spend in 2020 on health and healthcare, 8.7 trillion. For me, it's a staggering increase. When it comes to experience, it's a personal thing for me, because I found out going through an MR a few years ago that I suffer from claustrophobia. So I'm part of that 15% that you see in front of you. And then, of course, there's the motion that is a result of many of these inconveniences that people and patients experience. Now, another staggering data point for me has to do with staff satisfaction. I'm curious what the panel will say about this, but 49% of radiologists are in a burnout type of situation. And of course, if I had 12 billion in my hand today that we don't waste on unnecessary charges, but we actually invested in a future of health and healthcare, I think we would be talking about much better outcomes. So, if we know that, and we call that the quadruple aim, what is then the answer for MR to all these challenges? Now, and I will make it very simple. I will call that speed, comfort, and confidence. Now, and if I take you through just a few examples when it comes to speed, something that we call compressed sense is very meaningful. Our customers that have worked with us are telling us that they reduce the scan times by 30 to 50%. This is meaningful. This is driving productivity. Comfort. I talked about it before, and I think it's important that we are able to show that with Herlev in Denmark that we can reduce rescans with 70%. And then, of course, it's all about diagnostic confidence, getting the right diagnosis as soon as possible. And that we can drive by better spatial resolution, up to 60%. So that's a big improvement on diagnostic confidence. Now, when I then think about understanding all these challenges, I think it's important to understand each other's challenges. And if we are able to team up, we can solve these challenges together with you.
I've been waiting a long time for this exam, and I'm not sure what to expect.
Appointment requests never stop. We're racing against time to handle growing patient volume.
My schedule is very tight. I spend a lot of time to get insights to interpret an image.
I'd like to spend more time on the patient instead of the technology. This will make us a better caregiver.
At Philips, we understand you. We believe we can break the boundaries that prevent you from organising care around the patient.
Our MR solutions are designed to provide a simpler, faster, smarter path to a confident diagnosis.
We do this by connecting people, data, and technology to help you deliver a better care at lower costs.
And we increase productivity, allowing you to scan more patients per day or include additional scans in the same time slot.
And we dramatically improve the MRI experience to make patients feel relaxed and comfortable.
We can help you to enhance clinical decision-making and spend more time with the people who need it the most, your patients.
Expect much more from Philips. Together we can build a future and bring you one step closer to seamless radiology.
Well, thanks, Arjen, for that great presentation. I heard 3 main topics for today: speed, comfort, and confidence. So let's kick things off with our first question. How does your facility improve the productivity of your MR imaging service? So why is increasing productivity becoming more important in today's healthcare? Well, because the reimbursement has gone down by more than 1/3 as part of the transition from volume to value-based care. And the number of patients with chronic conditions is projected to increase by 45% by the year 2025. And last but not least, the number of MR procedures has increased by 15% in a 4-year time span. So these are the reasons why Philips is putting so much focus on improving productivity. So let's start with our first poll question. For those joining online, please select your answer by choosing one of the options on the screen. Remember, you need to be out of full screen mode in order to join the poll. So let's go. The poll is now open. Please answer the question. How does your facility improve the productivity of your MR imaging service? Is this by optimizing the MR system uptime and utilization? Perhaps by simplifying your workflow or decreasing the exam time? Or is it by reducing unnecessary rescans? While you're voting, don't forget also to ask your own questions directly to our panel about productivity via the question box at the bottom right of your screen. So while we're waiting for your results to come in, and please do keep voting, we want to hear from you, let's just pick up those points there then. What do you make then, Dr. Oswood, of these options? What would you go for?
Well, at our institution, we're really excited about the use of compressed sense. We got the Elition 3T scanner about 5 months ago. We immediately incorporated compressed sense into our protocols, and we're seeing overall 20 to 40% reductions in the total scan time for different protocols. So it's being validated in the real world in our experience. And the image quality has been excellent. When I'm reading the scans, I can't really tell, unless I look at the text on the bottom of the screen, whether it was done with compressed sense or on the Ingenia scanner. So we're really excited about that as a way to reduce scan time and still maintain excellent image quality. Now, I know that not everyone has compressed sense yet. So another problem that frequently comes up that causes rescans is patient motion. When this happens, the technologist will often just get on the intercom and say to the patient, please hold still and run the same scan again, and they get into this cycle where repeated patient motion. So what I advise our technologists is when that happens, just immediately go to the motion compensated sequence, which is called multivane on Philips.
Thank you. And I think we're going to turn now, because I think our poll results are coming in. So let's take a look at those 4 options, which was the most popular. So we can see from the options there that more people voted to decrease the exam time, some 40% then on that. Dr. Brown, what do you make of that? Of those 4 options, does that resonate with what you find in your facility?
Right, so I think speed you have to look at from different perspectives, and from the patient perspective, of course, it's reproducibility and confidence in that result that you're scanning, so you don't want to have repeat scans. But from the radiologist perspective, it's really improving image quality by utilizing those new techniques that were just mentioned. So, for one, in the new Elition system, which was put up at our site about a year ago, the Vega HP gradient really enables faster and higher resolution scans, diffusion scans. And also compressed sense is something that we are really heavily utilizing to improve scan quality or speed, and then from that dedicate higher scan quality, because in abdominal imaging, motion is a huge issue, and anything that compensates for that is welcome.
Thank you. Well, we are going to be taking questions from our online audience throughout this session. Let's go to one of those now. We've had a question come in from Miguel. Besides increasing imaging service productivity, how do you ensure a high return on investment? Well, Dr. Mahajan, what do you make of that?
See, for me, return on investment, I see in 2 different boxes. One, if a patient has gone through a comfortable scan, is happy, you get an accurate diagnosis done very quickly, the physician is happy, that's return on investment for an MR. The second point is regarding the financial return on investment, which is very important. So depending on where you're going to house the MR, you have to choose the right machine to buy. There is a whole menu that's available. And what we found with the new Prodiva, which we've had for just over a year, is that it's a lightweight magnet, just 2,700 kilos, so you can house it anywhere in the hospital. You don't specifically have to choose a place. You don't have to reinforce the floor. You can put it even on the 5th floor of the building if you want, without reinforcement. power requirements are very low, which means you're saving money on an ongoing basis. In India, we charge very little for an MR, anywhere between $35 to $100. So really, you have to choose very diligently, but without compromising quality. And that's where we found this machine to be excellent.
And of course, you all come from different systems where reimbursement is different. What about in Switzerland, Dr. Yuli? What about return on investment as an issue there?
We face the same challenge. We've just taken delivery of an Ambition X system, and we had the challenge that the Swiss government has decreased our reimbursement significantly at the beginning of the year. So now we're using the new platform together with compressed sense to shorten examination times without compromising on image quality, because we are still dedicated to our patients. Yes, there is reduction in reimbursement, but we are trying to find a compromise between optimizing scan time and still delivering the same quality service we are having to deliver on to our patients. And there's one thing I'd like to add. Switzerland, in that respect, in particular the Zurich region where Spital Uster is located, is a special place in the world. This is the highest density of magnets anywhere in the world. We're talking, I think, now in a radius of 20 kilometers, 70 magnets. So we as a healthcare provider are measured by what the image quality of our surrounding centers is and the report quality. So there's a number of options we have to weigh against each other, but certainly compressed sense with the new platform helps us to deliver what we need to deliver.
Thank you. So questions are coming in online, but also from our live audience here in the studio. I'd like to take this question next. How do you deal with the shortage of radiographers? A question from John Ray. Dr. Le Quinn, do you want to pick up on that? Shortage of radiographers, is this a problem for you?
Definitely, yes. We try to have the best, of course, and especially in the pediatric hospital, you will really have to have dedicated ones. But it's a tough market, and we really need that because, well, they are key for getting good images. Well, we can make a good protocol and think about the diagnosis things, but they really are into the most important process to get a good MR, which is really diagnostic for us to read out. So.
And is this a problem in America, Dr. Oswood, the shortage of radiographers?
Yeah, it's always challenging to find qualified MR technologists. It's a very demanding job, and they work very hard. And that's where we have to work on increasing productivity and also looking at your whole process. Are you having your technologists do everything when the patient comes, or can there parts of it you can get other personnel to do, from greeting the patient, getting them changed, starting intravenous lines? So you kind of need to look at your whole workflow and see how you can divide it up to have the technologists or radiographers focus on what they're really good at.
So, thank you. We've got another question now. Charles has messaged us asking us, what's your preferred solution for saving time? Dr. Yuli, do you have a preferred solution for saving time?
Well, the preferred solution, first of all, is to really optimize all the processes within your department and to really streamline your workflows. But there's only a certain level of streamlining you can do, and then the technology has to help you. And then you need to be able to combine, for example, with M-Dixon, we can take a number of weightings together in one sequence, the breast salt sequence, and that speeds up time. Retakes have to be avoided. In cardiac imaging, that's absolutely crucial. If a perfusion scan with adenosine stress goes wrong, that is something that really impacts on cost and on patient care. And so therefore, the equipment we need is equipment that allows us to deliver an adenosine stress perfusion at the highest possible quality and the highest reliability.
Well, thank you all for your responses there on the topic of productivity. Let's turn now to our next topic. So now let's consider, how do you improve patient experience with MR? Well, we all know that patient experience is important, but how does it fit into the overall healthcare picture? What's the real impact of it? There are statistics indicating a direct link between patient experience and the financial performance of hospitals. For hospitals with excellent scores in patient experience, the net margin is 4.7%, while the facilities with low scores have only a 1.8% margin. In addition, the employee retention rate increases when a hospital focuses on improving patient experience. And lastly, there are indications that hospitals that provide higher levels of patient experience also deliver higher quality clinical care. So, stronger patient experience has a direct and positive impact on the financial, staff, management, and also the clinical outcomes. So, let's see how the online audience improves patient experience with their MRI. Do you focus most on a better patient preparation? Perhaps on a patient-friendly scanner environment? On providing guidance during the MRI exam? Or do you invest in patient-focused staff training? Please enter your responses to those questions now online. We'll keep the lines open. And meanwhile, if you've got some more questions on the patient experience, please type those into the box. We'll put those directly to our panel too. So while we're waiting for those responses to come in, let's have a look then at the patient experience. Dr. Le Cuen, with your patients who are particularly the pediatrics, the youngsters, how can you improve that?
Well, if I look just at the 4 options, I think I will need all of them, because it's really essential to have a very good scan. And well, we start off, if we have time for the scheduling, we really go even outside of the MR suite. So what we do is sending the child and the parents to a mock scanner. That's a sort of duplicate of a normal MR system without the hardware. So then they are allowed to lay on the table, and they can feel the coils, how heavy they are, and they can even go into the tunnel. But our experience is also that, well, important is also to show them or listen to the noise, because that is one of the reasons, especially if you start with the MR exam, that the first 2 sequences are moved a bit because the child is just afraid of the noise. So this is really important. And then afterwards, if we go into the MR suite, we have other options of, well, nice environment and this kind of things. But in the older ones, we really see a very good distraction thing with the videos. And the only thing that I heard from the older ones are they are complaining a bit about the simple videos they see. So
they want a better choice of video.
Yes, yeah.
Okay, well, I think we can turn now to the results of this poll. I think the results are now coming in. Let's see. So the clear leader there at 44% of our respondents is that patient-friendly scanner environment is important. As you were saying there, light, noise, visual distraction. To pick up on that, Dr. Mahajan, I think you have a special way of distracting patients. What do you do?
Yeah, we really rely a lot on giving the patient a good MR imaging experience. And towards that end, when last year we bought the Ingenia 3T, we actually said this is a machine that's come from the Netherlands. And so what we've created is a garden into which that machine is housed. There's grass on the floor, there's tulips on the walls, there's a picket fence. And of course, there is a television, there's an indoor experience, which helps a lot. But the patients really appreciate the effort that's been put into it. It distracts them from the machine itself, from the imaging, and it helps in getting them comfortable.
Let's go to some of the questions that have come in from our online audience. What effect do these shorter examination times have on the patient experience and patient compliance?
I think in GI oncology, compressed sense really has a huge impact on scan time, which is for these patients who have really difficulties lying for long times because they're in pain or compromised in terms of their breathing cycles. If you can reduce, for example, in a dynamic Dixon sequence, your breathing breath hold from 12 or 13 seconds down to 9 seconds, this is really something that patients appreciate a lot, and which then directly returns into improved image quality.
Okay, let's turn now to the question that's come in about what effect do these shorter examination times have on patient experience and indeed on patient compliance. Dr. Oswald, what's your take on that one?
Well, I think that's very important, particularly when we're looking at our cancer patients. Some of them have severe back pain. It's very difficult for them to lie still for the examination. So the shorter you can make the examination, the more likely it is that they'll be able to complete the examination in one session rather than having to be rescheduled and come back for a second appointment or get sedation. Also, we've noticed with the Elition that Philips did redesign the mattress of the bed that the patient lies on, which sounds like a very simple thing, but the most frequent comment we're getting from our technologists is that for patients who've had scans on other scanners, this new mattress is really significantly more comfortable. And that's something that can improve their experience as well.
That's really helpful, thank you. We've got another question come in now. Andrew has messaged us saying, with such huge pressures on productivity, is comfort really as important as speed and confidence? Dr. Yuli, do you want to pick up on that?
I certainly think that you have to make it as comfortable for the patient as possible, but we are not here for a fun ride. This is an examination, and we need sometimes actually to make the patient even uncomfortable. Again, I take my example, adenosine stress imaging. We're putting somebody into a tight tube and we're giving them a drug that makes them feel somebody is sitting on his chest. So what really helps from my point of view is actually to give a visual indication of how long the patient needs to hold his breath to, when we beforehand explain to him, yes, this is going to be uncomfortable, but don't worry about it. We'll supervise you very well. We're here with you, and you get an indication how long you need to hold your breath. Then that's actually helpful to the people. We had very positive feedback on that.
And what about a question from the live audience here that's come in? Would television help during the examination? Dr. Mahajan, television?
It does help.
Yes?
It does help. Even if, they aren't seeing it as closely as, they would have thought. But the very fact that when you tell them that you'll have an inboard television, it helps. It helps in compliance. And we've seen some patients who are genuinely claustrophobic. We've been able to babysit them through the examination.
I think Arjun himself was one of those, so he might need a little help too.
I'd like to share a comment of one of my patients. He actually said that the inboard experience made him feel that he was not in a magnet, but that means that it requires that the patient actually embraces this and tries to relax himself a little bit. And so when the radiographers explain this well and explain the function of the mirror well and how the patient should actually look into the mirror, that is what adds to the success of that technology. And I have now experience with 3 magnets that are equipped with inboard experience, and we have, through the bank, fantastic responses from the patients.
Well, thank you all for those comments. I think we need to move on now to our next topic. We're going to now look at the next subject, and let's turn to that. So now let's consider, how do you improve diagnostic confidence without compromising on speed and patient comfort with magnetic resonance? So how does diagnostic confidence impact healthcare? Why is it important? Well, first of all, it has financial consequences. Malpractice claims caused by diagnostic error are on average $350,000 per claim, the highest among all. From the patient perspective, more than half patients stated that diagnostic errors were their main concern. And what's more, diagnostic error is a major cause of patient harm, which happens on as much as 10 to 15% of occasions. So this background triggers us to look at ways to continue to improve diagnostic confidence and to bring this into discussion. So let's have now our third poll question. How do you improve diagnostic confidence without compromising on speed and patient comfort? So choose, do you prefer to improve image quality through new clinical innovations? Perhaps you'd like to explore artificial intelligence to improve your diagnostic confidence, or adopt quantitative imaging techniques for decision support. Or perhaps you'd rather invest in training and education of staff. So again, please put your answers now online, and do send us also your questions related to diagnostic confidence. So while we're waiting for those poll results to come in, Dr. Yuli, which one would you pick?
Well, it's a tough choice, to be absolutely honest with you. So I think I would actually choose all four, and I would leave it to the online audience to decide. I can't at the moment.
Dr. Lequin, what about you? Which of those would you go for?
Well, I think I would like to go for a combination of two. It's not commercially available yet, but I thought about it would be awesome to have a tool for the radiographer that if you have a lot of movements of the child scanning, that it will pop up and alarm him. Another one is pattern recognition. So we do a scan and there is something major and we have a simple protocol. Then he calls us, the radiologist, and say, well, I've seen this. Should we change our protocol or not? Or should we add some extra? And that would be awesome. So.
Thank you. I think we can now see our poll results coming in from this third question. And let's have a look there. So it seems that the first answer, improving the image quality through clinical innovations, 35% of our respondents went for that. Dr. Brauching, what do you make of that?
Yeah, I would go with that as well. I mean, high image quality, I think, is key to confident exam result and correct diagnosis. So if you can improve your image quality, that's really important. For example, in diffusion imaging, if you can go for higher resolution scans, in our field, this can make really a big difference in GI oncology. For example, if you take a patient with a pancreatic cancer, primary diagnosis, and a small lesion that may be a metastasis in the liver, at the dome of the liver, that's detected or not detected decides between palliative treatment and surgery, which should be curative, ideally. So this really does make a huge difference.
And what about Dr. Mahajan? What's your response on that?
I think it's a combination of all, but more importantly, new technological innovations. Like on the Ingenia, we use APT imaging for brain tumors, and that really is able to help in differentiating viable tumor tissue from post-radiation necrosis. Similarly, I think the future probably would belong to artificial intelligence, where it'll help, delve into areas which we as yet haven't gone into. But that again is new technological innovation.
Yes. And the innovation is usually led by America. Are you ahead there, Dr. Oswood?
Oh, yeah, I think one way we've been able to improve our confidence is using compressed sense. I do a lot of brain imaging, and we used to do the flare sequence using a 5 millimeter thick slice. Now with that compressed sense, we're able to take a 3D or volumetric scan from about 6 minutes down to maybe 3.5 minutes. So then instead of just having the axial plane, if I see a lesion, I can ask the technologist to reformat into a different view and increase the diagnostic confidence. And we do that while saving a significant amount of time.
Okay. You want to come in there, Dr. Burrow?
Right. This is also a big issue, for example, in pelvic exams for rectal cancer patients. We used to do 2D scans, and then you're bound to the imaging plane that was acquired. Now we do 3D imaging of the pelvis, isotropic imaging at very high resolution and a reasonable scan time at 0.8 millimeter resolution. And this then enables offline reformatting in any angle that you wish for. So this really helps.
Thank you.
Yeah.
We've got another question just coming I'd like to squeeze in about asking how you manage difficult patients to ensure the high quality of images. Patients perhaps with a high BMI, a cardiac issue, onco. Rolf B set this in. Dr. Yuli, how do you manage with such patients?
Well, share a little story about the Ambition X. We set up the cardiac protocol just by putting one of our radiographers in the bore, 60-kilogram woman, set up the protocol. Next day, we had a 140-kilogram man. This was our first clinical patient for the Denison stress test, and a few adjustments to the protocol. It worked out of the box. And for us, this was impressive because we tried to do this patient on our Achiever D stream, couldn't fit him into the bore, and then we have the brand new magnet, try it out, and it worked perfectly well. We even been able, with compressed sense, again, it's a key technology now for a lot of things we do, to run a perfusion sequence at a heart rate of 88 beats per minute, a spatial resolution of 1.9 millimeters in plane, and that means that an inflow artifact is not really an issue there. So that patient even had sterile wires, and all of this was perfectly handled by the sequence.
Okay. Another question coming in I'd like to take now. Do you see the role of AI, artificial intelligence, as it stands today in teaching and enhancing skills of radiologists? Dr. Mahajan, you're keen on AI, I think.
Yeah, our group works in that field. And, it will become a radiologist assistant very soon. It would enhance the skill of the radiologist, make hopefully an average radiologist good and a good radiologist excellent, and also probably be able to cut short the time that we take for reporting, and maybe in the long run, because of this, be able to cut costs. So I see this really as enhancing the skill of the radiologist.
Thank you. Another question just come in. Heike has sent us the question, if artificial intelligence can help to concentrate more on the patient and the result, this could be of benefit to all. Is that, Dr. Le Quinn, do you think that's valid?
Oh yeah, definitely. And well, what is already mentioned about, well, if we have a possibility of a sort of second reading, that's especially in my hospital, as in pediatric oncology center, very important. So, well, it's easy to miss important things. And if you have a computer running with you and saying and pointing out something, you can ignore it, of course, but most of the time the computer is right. So it's really helpful, I think.
But Dr. Yuli, are we going to be replaced by AI, all of us, but particularly radiologists?
I don't think so, because in the end of the day, the patient would like to have actually a person that is responsible for the report. And where I see AI being particularly applicable is, for example, I'm not a specialist neuroradiologist, nevertheless, in my daily routine, I have to do it, and I like doing it. When I have to compare MS lesions with a follow-up scan, then one of the most, excuse me when I say that, tedious things is to count lesions. So if I have AI to help me and point out, oh, have a look at that, there's activity there, then that would be my great buddy.
But while we haven't been replaced by AI and there are still radiologists out there, human error can always be a factor. How on earth do you compensate for that? Dr. Brown?
So I would like to comment on the last point. I think AI goes further. It goes also into texture analysis and programs that detect specifics in images, which we should look at data rather than image, in my opinion, and identify, for example, subtypes of disease that are not just visually, can't be visually identified. So I think AI has a huge potential to accelerate radiological diagnosis.
And a question coming in on this issue then from Mark, how do you decrease human error to increase diagnostic confidence? Dr. Oswood?
Well, I work with a lot of trainees, and obviously they're prone to error just due to inexperience. And one thing that we've found helpful is to use structured reporting. So rather than starting with a blank report, they're starting with a template that covers, for example, the different parts of the brain. It'll look at the ventricles, the brainstem, the cerebellum, and so on. And it gives them a checklist to go through as they're reviewing the study. So it can reduce their error because taking out, say, places they might forget to look.
And Dr. Le Quinn, what about you? How do you reduce human error?
Well, what I did is I collected as much as possible normal cases, because in children you have the problem of tiny ones from just a couple of months till 18 years. And with this normal database, I really compare this, and I tried to push the residents to look into it, because a lot of things you're just missing because you have not this idea in your head that this vermis is too small or the brainstem is too big or whatever. So that is one of the ways I do it.
Thank you. Well, it's been really interesting to hear your views on these issues concerning productivity, the patient experience, and the diagnostic confidence. I'm going to ask you now to peek into the future just a little bit for me and tell me briefly, what ideally would you like to see in the future for radiology in this way, or would you expect to see? Let's start at the far end, Dr. Waren. What's in your crystal ball?
So I would like MR to become available for all people who need MR scans. I think that is really one important issue that we need to clear. And then in MR, I think I would be very happy if we actually start developing and applying in the clinic quantitative MR markers as biomarkers or surrogate markers of disease endpoints. This would really strengthen, I think, our position and the usage of this technology.
Thank you. Dr. Yuli, briefly, what would you like to see?
My ambition is very much like Dr. Barn. I'd like to have MR available to anybody, and I'd like to make it more available by putting MR scanners in large shopping malls.
Wow.
And having a centralized booking system, so when the patient wants to have a scan reported by a particular colleague, maybe myself, so he books the appointment and I tell him, well, we'll have a scan slot for you available.
Lovely. Dr. Mahajan, beyond the gardens, what are you looking to the future to see?
Beyond the gardens, I think artificial intelligence, I think it's coming. It's going to be big. Two ways in the future that it's going to change the way we practice radiology. One, for certain normal things, maybe the radiologist won't be needed. Also, the underserved part of the world where radiologists are not available, AI algorithms will play an increasing role, both at the hospital level and small doctors who are practicing and are helped by artificial intelligence. And what I would really wish for is for radiology, for artificial intelligence to start helping radiologists get better. And if it can be tied on to the clinical details, which are very important, as well as genomics and molecular diagnostics, to evolve the radiologist from what we do today to someone who's higher, who's bigger, who's on top of more things than just images alone.
Gosh, a big ask. Dr. Oswald, what's your request?
Well, I think right now most people think of the radiologist as someone who sits in office, sends a report, and then sends them a bill, and they never meet them. And I think the radiologist should be someone who meets with the patient, explains their results to them, and advises them on what the next diagnostic or therapeutic steps would be.
Excellent. The human factor is still there. Dr. Le Quinn, what would you like to see or expect to see in the future?
Well, if we push more on the prevention part, maybe we should get rid of hospitals even, so, well, avoiding burnouts of radiologists, so that would be great.
The end of hospitals, gosh. Thank you all very much indeed for your contributions. That's fantastic. Well, Arjen, what a great journey. And these challenges, of course, are felt by many, but it isn't easy to solve these issues. But it seems that perhaps Philips is on the right path to find solutions to some of these issues. So can you share with us what are your takeaway messages from the points that our panel have made today?
No, pleasure, Sue, and of course, thank you, dear panel, for all your remarks. Now, again, I think it was fantastic to listen to this panel, and I'm happy to share a few insights that I have. I was, by the way, also struck that very often we say, even if we need to make one choice, we still would like to have a combination. And I think that is a testament to the challenge that we have in front of us. But key insights, I heard a lot about productivity, and I talk about speed a lot in MR, in Philips, but I think that resonated quite well. We talked about staff experience, and when it comes to staff experience, how do you make sure that you get more out of experienced people, train them to get there, but also make sure that they keep fun in what they do and have a good return on that activity. We heard a lot about pediatric patients. How can you work on their experience and make sure that it delivers a comfortable experience? So comfort came up there as well. And then something we all talk about a lot, and that's artificial intelligence. And I think we would love to see the promise of AI really coming to fruition when it comes to diagnostic capabilities. Quantification, and I think there was a balance between image quality, but at the same time also let's quantify images, quality to quantification to help with diagnostic confidence. So all in all, it's complex, and if we want to go to seamless radiology, we clearly need to collaborate to break down diagnostic boundaries. And I think that's just very exciting. And when I think we are transforming healthcare, I think we're in the middle of it. I'm not sure where we are, but it's going to be something that we will have to push forward. Imaging will be in the center of it, and I'm personally convinced that there will be a key role for MR in that transformation in healthcare.
Arjen, thank you very much for sharing with us the Philips vision. And thank you again to our panel of experts for all their insights and best practices. Thank you too to our online audience for their active participation. Well, this is not the end of the conversation. Please keep on watching. At the end of this live stream, you'll be able to explore the Philips website for more information. Sign up to speak directly to a Philips representative or for an exclusive VIP tour on the Philips booth at RSNA. Thank you for watching. Have a great day. We leave you with a video to show how Philips aims to make life better.
Success in MR demands a shift in perspective about what imaging can do for your patients, your institution, and you. The shift begins when you partner with Philips. Together we can create the next generation of MR, unlocking untapped potential. Achieving a simpler, faster, smarter path to a confident diagnosis. Bringing data, technology, and people together seamlessly. This new perspective elevates the MR experience. And touches more lives than ever before. Because today, health knows no bounds. And neither should healthcare. There's always a way to make life better. Innovation and you. Philips.